Haiti is a nonprofit organization based in Richmond, Virginia that was started in 2004 by a certified nurse midwife named Nadine Brunk, who took this charge to decrease maternal and infant mortality in the Central Plateau and put a plan into action to train Haitian women to take care of each other. So Midwives for Haiti's big program is education of auxiliaire as midwives. The auxiliaire are something similar to LPNs in the U.S. They've gone through a 12-month program after graduation from high school, and many of them have worked as nurses in other facilities or as auxiliaire. These are entry-level nurses, and then they spend about 12 months with us learning specific women's health and obstetric care skills.
My name is Martini Raphael. I am a nurse midwife, and I've been working in the program since October 2009. I am a teacher for the Midwives for Haiti program. Right now, we have 11 students, and the class will be for 1 year. In November of 2007, they estimated there were only 197 trained midwives in all of Haiti. The Americans were really touched by what they heard, so they recruited a group of students to learn how to be midwives to help mothers and babies. Here, there are a lot of women dying during birth and a lot of obstetric emergencies. The maternal mortality rate in Haiti is 623 per 100,000 births.
Maternal mortality rate in Haiti is the worst in the Western Hemisphere. The lifetime risk of a woman dying in childbirth is 1 in 40, and the chance that her baby will live to 5 is very low.
It's a program to reduce infant and maternal mortality in childbirth in Haiti. And that's why the American midwives have come to help with that problem.
I heard about Midwives from Haiti from one of the providers from my hospital, and I was very much interested. Although I'm not a midwife, it was important for me to come and see the work that you do, especially in educating the women of Haiti. We went to Marmont in back of a pickup truck, which I thought was awesome.
The overall goal of Midwives for Haiti is to decrease the maternal and infant mortality in the Central Plateau. So to do that, we have to go to where it's happening. The mobile clinics started as a way to reach the women in the outlying villages around Munsch, because even though they may not be far by car, very few people have cars, and by donkey or on foot, it can be very far. So the idea with the mobile clinic is to go to the women where they are and meet them where they are. The mobile clinics are run by 2 graduates of the Midwives for Haiti program. They have gotten so accustomed to it that it's quite a well-oiled machine.
When we arrived at the little church, what we found was, barely anyone was there. However, as we were setting up, within 5-10 minutes, we were swamped with all these pregnant women. It was unbelievable.
They've been doing it long enough now that the women are expecting them, and word has gotten out, and word of mouth is very powerful in Haiti, and the women know to come, and they have come to trust the midwives and trust what the midwives tell them.
What was so amazing to me was the students and the 2 auxiliaires that were hired functioned so well, so professionally. Although they didn't have all the materials, like a couch or a cot, what you saw was they made do with what they had. They had a patient on the table, blood pressure, weight, all the things that we would normally do in the U.S. Everything was handled in such a way that it put me to shame by the mere fact they had so little, but they were so professional.
Normally, when the students and midwives go to the mobile clinic, they will unite the women to educate them on how to eat and take care of their bodies during pregnancy. They talk to them about the different stages of pregnancy, how the first trimester can be very difficult sometimes, that the women can feel uneasy.
You were trouble nausea, you were figi à pamphlet, you were des fois à fait mal.
They tell them this is normal. They also talk to them about the danger signs, especially the second and third trimester of pregnancy. If they have bleeding or pain, they have to go to the hospital. And signs of preeclampsia or eclampsia.
It seems that the program is working. The graduate midwives are doing a good job, and in an interview that our wonderful translator Magali did with one of the women, it was very clear that the woman had heard what had been said about the signs and symptoms and about what she should do to take care of herself, and was able to repeat that.
And it was her first time there. She said, I have malaria medication, I have prenatal vitamins, and I have iron. And I said, can you show me which is which? She didn't just pull it out. She told me exactly which medication was for what purpose. And able to tell me, as she puts it, pour faire bien, pour ça délivrer un bébé qui fort, meaning to make me well in order to have a strong baby. And that's it. Courage. She knew exactly how to get herself well and her baby well.
In health education and health promotion, when someone is able to repeat to you what you've just told them, that means that they understood and they've remembered. And it feels like it's really working, that this is really doing what we intend for it to do. From a outcomes measurement standpoint and from the sort of science of public health side, it's really important to know that what you intended to do is really happening, and I think that's a pretty powerful outcome.
After the earthquake, there was a lot of attention on Haiti, as everybody knows, and I was getting a lot of emails asking for midwives for various organizations, and I decided that I wanted to go. I basically decided, why am I not going? Haiti is so close to us.
I was particularly excited about Midwives for Haiti because of the focus on education, and that we're not going in there to staff the hospitals and catch babies and leave. We're going in there to help educate and train the local midwives to be better care providers. And it's a huge learning experience for us as well. Certainly the exchange is great.
And we are always checking that their bleeding is okay.
Participating in the Midwives for Haiti program, we are expected to help with the training of the student midwives, to teach them a class, and I taught them about maternal mortality. My partner who came with me taught about breastfeeding, so you can talk about whatever is your specialty.
Along with being a midwife, I'm also a board-certified lactation consultant. So I led a class on breastfeeding and lactation. And again, I was quite impressed with how much they already knew. But we practiced technique, we talked about potential complications and how to resolve them. And it was really nice when we went on the mobile clinic the following week that their teaching point that day was on breastfeeding and lactation. And it was great to really see them in action just a few days after I had taught that lesson.
The hospital conditions in Munsch are nothing like we've ever seen in the United States. The labor ward in Munsch has one big room, and it's separated by partitions. They've recently renovated, so there's now a little bit of privacy because of the walls that are in between. There are no bathrooms for the patients, and there's a non-functioning toilet for the staff. So obviously conditions are difficult. Every night the lights would go out at about 9:30. The electricity would go out, and the midwives would turn on their headlamps and flashlights, and without skipping a beat they would continue working. The generator would kick in about an hour, 45 minutes to an hour later, and we would have some electricity for the bulk of the night.
So you make do. I mean, I think that's one of the benefits of midwives working in those sort of conditions, is we're really good at making do with what we've got. But I was quite impressed at their level of education, their level of competence, and just how kind they were to the women and how considerate they were in the face of some really difficult situations. Haiti is an amazing place. It's shocking how kind and compassionate and welcoming and open so many of the people were that we met, especially in the smaller town. It felt very safe and very warm and very welcome, and it absolutely gets under your skin. I'm planning on going back, and hopefully we'll work with this organization for as long as I can.
This was the first time that I've ever been to Haiti, and it was surprising in how compelling the country is. The spirit of the people is very, very strong. Before we even left, we were talking about how we wanted to come back and how we could continue to keep up the friendships that we had made, stay in communication with the people that we had met.
The pride that I felt as a Haitian woman to see that this was a hope that eventually, maybe, as you would say, lifting themselves by the bootstrap without waiting for the government to actually do something. As a provider, you could see the learning aspect because they're also able to teach others.
So sometimes it's really difficult to gauge the progress of any program in a developing country. It's often slow and very incremental, but it's happening for us here in Haiti. I feel the change. A hospital management system in Virginia, Bon Secours, has given us a grant that will allow us to support the drilling of a well that will be deep enough to provide a sustained water source for the hospital. So having running water in this hospital is going to be a huge victory. And it's not just Midwives for Haiti's victory, it's certainly Bon Secours and all of the other partners that have played a role in this, but we couldn't be happier, and we feel like that's one very obvious sign of how our presence has helped here.
Remercier en pile American sage-femme.
I want to say thank you to the American Midwives for starting this program to help the women in need in Haiti.
Mais yo fais un pile changement.
There is a lot of change, but we can't stay here. We have to keep going. So we need more help, more materials, and more students to train.